as you all know, that International Forum for Promoting Homeopathy is conducting regular sessions in three languages. 7 to 8, we have our Hindi session, and 8 to 9, we have the international session in English, and 9 to 10, our local language session in Malayalam. Today, we got one of the best doctor from Malaysia, and he is an Indian, and is a professor, Dr. Partha Chakraborty. As you know, that sir has presented so many presentations, particularly about the brain tumor and its management with homeopathy in this forum continuously for 4 sessions, and some other sessions about acute diseases management and everything. And today, sir will be talking about a different subject. But before that, let me say a few words on Partha Chakraborty, sir. And sir is the professor presently working as Associate Professor, Department of Homeopathy, Lincoln University, Malaysia, and is currently pursuing online courses on medical neurosciences. And he has completed his MD in homeopathy, and then B.Sc, FSS, and FF homeopathy. So many degrees, and the winner of FF homeopathy Home International Award and MD homeopathy with over 26 years of experience, and has an experience has more than 2,000 acute cases as well as chronic cases in his kitty. Has done beautiful practice with the homeopathy for the last 26 years. And he was a former assistant professor, BV Homeopathic Medical College, West Bengal, and a visiting faculty of PPHM Malaysia in 2009, 2012, and 2006, and is the visiting professor of Clinic Zahara, Colombo, Malaysia, in 2019. And this is the area he has expertise in teaching the subject of homeopathy to students and doctors, and experience in history taking routine diagnostic investigation and coordinating with the healthcare team to ensure prompt response to medical problem, interacting with the specialists and multi-specialty unit to ensure world-class standards to the patient care, ensuring and monitoring administration of appropriate drugs to the patient, handling patients, counseling sessions, and all these things are there with our guest, Dr. Partha Chakraborty. And sir has published so many publications, and you can get all those things from our poster we have presented today. We have a discussion, not only the presentation, but also the presentation on thyroid disorders. So many people have presented a different subject on thyroid disorders, but this time, sir is talking about homeopathic approach in the management of cases of hypothyroidism. As you all know, that this is a subject which need very, very thorough understanding and very good chance of recovery, getting famous with treating such cases and curing such cases is a great thing. And I invite on behalf of International Forum for Promoting Homeopathy, Professor Dr. Partha Chakraborty, sir, to this forum. Welcome, sir.
Thank you. Can you hear me, Dr. Danesh?
Yes, sir. Yes, sir.
Okay. Thank you very much. Good evening, everybody. And my sincere regards to my teacher, PG teacher, Dr. Shahani sir. I'm fortunate to be having here Dr. Shahani sir over here. So my pranam to him, and my sincere regards to my friend Dr. Dhanesh and everybody over here. Let me share the screen.
Yes.
Now,
Fine.
I know that this subject has been discussed many times in this forum. It is an international forum, and it has got a lot of scope. And many people, I've gone through many lectures, many people have talked about this hypothyroidism. It's not a new thing. new thing over here. But I thought that I can put some of my insights, some of my experiences in approaching these cases, because we are dealing with these cases as we are growing experienced in our clinical practice. Difficult cases are coming to me. It's my own experience, it's the experience of all experienced physicians. And nowadays, I have seen that there has been an increased interest in the patients to undergo an homeopathic advice, to take a homeopathic treatment for their endocrinological problems. And the two most common problems that we see, endocrinological problems that we see uh, in our clinical practice, one is thyroid disorders, more specifically hypothyroidism, and the other one is diabetes mellitus. And as the days are going on, we are seeing that more and more people are suffering from these two disorders. And they are fed up. They are getting fed up. They are getting frustrated with the continuous allopathic mode of medication. They are having a lot of complications. They're not willing to take the medicines for the whole life. And they are coming to us with requests that please treat us for these problems also. So it has become an interest in mine that we should try. We have got a lot. I think that we have got a lot of scope in managing these sort of endocrinological problems. Now, before I begin my lecture, I can share one small interesting experience that I had around 26, 27 years back when I started my clinical practice in this place. At that time, I was a very novice, very newbie, just graduated from NIH and came down to start practice. One couple came to me. I remember, one couple came to me. They were also of the same age, and that person was having a laboratory, pathological laboratory, and his laboratory was very well established over here. He came to me with his wife, and he told me, "Doctor, do you have any medicines for thyroid?" This was the exact question that he put to me. Doctor, do you have any have medicines for thyroid? Then I told, what is her problem? He told that she is not having any problem. She's having a thyroid problem, and you have to give her medicine. We don't want to start allopathic medicines, because he was already attached to many allopathic doctors, because he was having a laboratory, and he was not willing to go for allopathic drugs. Now I asked the wife, the lady, that, Madam, what are your problems? Just tell me what are your problems. And that person interfered and told me that she's not having any problem. She's only having thyroid. Please give her medicines for thyroid. Why I'm telling you this thing? But because this has been an experience with not only me, but with everyone in our clinic. People come to us, just ask us, give us some medicine for thyroid. Okay, so this is a very common approach that we find in the patients. And I remember that I insisted upon that lady that, you please tell me something. You forget the thyroid for the time being. You tell me what are your current problems that you're suffering from. Share with me. Then the lady told me a lot of problems I don't remember, because it's a long gone case. I remember only one thing, that she insisted that she was suffering from regular headaches. She was suffering from regular headaches, and the headaches were typically aggravated after going to the sun. When she used to go to the school to fetch her daughters from the school, she used to have a headache in the evening. So, based on this complaint and other complaints also, I remember I gave her natrum muriaticum. Natrum muriaticum. And I told you that at that time I was very inexperienced. And to my surprise, not only to my surprise, to the surprise of the person, the husband of that lady, the thyroid levels became normal. And the interesting part of the story is that that person, did not believe the result, that homeopathic drugs could improve the thyroid levels so rapidly. He went back to the laboratory Thyrocare. I remember that laboratory Thyrocare, and told that person that you have made some mistake. It cannot be like that. The thyroid levels have become normal within a few days. It cannot be like that. Then they again reconducted the test on the lady, and the same result was obtained. So that was the beginning of my career with thyroid cases. And after that, a long time has passed. I've been seeing a lot of cases of thyroid disorders. I've been seeing a lot of cases where thyroid disorder is a part of that problem. And now I'm trying to wean off these allopathic medications from the patient. And in doing so, I have seen that there are two or three approaches in which we can try to help the patients. So that is the main point of discussion for today, that I'll try to share my experience with you all, the approaches that we can adapt in treating the thyroid cases. You can also share your own experiences, and it's an open forum, and I think it's a great scope. We should discuss these things. We should create a protocol. We should create a, a path for the future generations, so that people with endocrine problems, especially hypothyroidism, can be benefited with the homeopathic medicines. I start my presentation with a quotation from Dr. Herbert Roberts. Uh, Many of you have read Dr. Herbert Roberts, and this is a person who was the first person to write a separate chapter on endocrinology in his book, The Principles of Art and Cure, The Principles of Art and Cure of Homeopathy. That book, he has devoted an entire chapter for endocrinology. I think he was the first person to write about this thing in those days, in the early part of the 90s, 1900, 20th century. So he writes, vast majority of human ills are traceable to dysfunctions of the endocrine system, especially the growth-related problems, maladjustments to the environment, and they are all related to endocrine imbalance. He has already written it there, and we are seeing it nowadays. Now, very interestingly, those who have studied physiology, you know that endocrine glands, they secrete a very small amount of hormone. They secrete a very small amount of hormone, and that small amount of hormone is enough to maintain our bodily function, to ignite a bodily function, to ignite a metabolic function, and to maintain that balance also. That small amount of hormone. And our drugs, we are blamed by the allopathic drugs, those who are materialistic in view. We are blamed that your homeopathic drugs do not contain anything. They are given in very small doses. So, if a hormone can act in a body, if a hormone can maintain a metabolism, if a hormone can maintain all the functions in a coordinated way, in a very small amount of dose, why not our drugs will act in infinitesimal potencies, infinitesimal doses? So that's one logic that I found, and I think that time has come that we must start treating thyroid disorders. So that's the thing. Now, there is a bit of stat that I will like to share, that thyroid disorders are on a rise in the world, and approximately 50 million dollars are spent every year to treat different types of thyroid disorders, of which hypothyroidism is one. It can be hypothyroidism, it can be hyperthyroidism, it can be Hashimoto's disease or autoimmune thyroiditis, it can be thyroid cancer, it can be anything related to thyroid disorders, but the amount is a hoping amount that is around 50 million US dollars. As I told you in the very beginning, that this is one of the commonest endocrine problems that we are facing in our clinics on a daily basis. This is a bit of small, anatomy for those who are non-medical persons over here. I know many persons are present over here. Just for your information, this is a small gland that is located in the anterior part of the neck. It's having an appearance of a butterfly. This is the right lobe and this is the left lobe. And these two lobes are connected by a small area that is called the isthmus of thyroid. And it's situated in front of the trachea. This is the anatomical situation. This is a very, very small gland, very small gland. Now, coming to the physiology, we have already done the anatomical portion, and coming to the physiology of the thyroid functioning, how do thyroid function? You can see this structure. This acts in an axis way. It's an entire axis that is acting. It's not only the thyroid gland that is acting. The process starts with the hypothalamus over here. The process starts with the hypothalamus in the brain. It releases an hormone called thyrotropin releasing hormone, that's in short called TRH. And that TRH goes by the blood and it targets the anterior portion of the pituitary. The pituitary is having two lobes, two portions, anterior portion and the posterior portion. And the anterior portion is stimulated by the TRH, which in turn secretes TSH. It secretes many hormones. TSH is one of the hormones which is excited by TRH, and TSH is released into the blood. That's called thyroid stimulating hormone. So from the name itself, you can understand that the activity of the hormone is to excite, to stimulate the thyroid gland. And it travels through the blood to the thyroid gland, it excites it, and in turn, thyroid gland secretes two hormones. One is T4, another is T3. T3 and T4, they are secreted from the thyroid gland and they spread to the peripheral tissues to help in the metabolic process. This is the axis in how the thyroid gland is acting. From the hypothalamus, TRH is released. It acts on the anterior portion of the the pituitary gland. From the pituitary gland, thyroid stimulating hormone is released. It excites the thyroid gland, and in turn, the thyroid gland secretes T3 and T4. So just be clear that TSH is not a part of the thyroid gland. It's not secreted from the thyroid gland. It's secreted from the anterior part of the pituitary. Now, what is hypothyroidism? In very simple words, hypo means slow. Slow. Hypothyroid means hypofunctioning of the thyroid gland. When the hypofunctioning of the thyroid gland occurs, it occurs when the thyroid gland is underactive, is hypofunctioning. It's not acting to its own potential. So an underactive thyroid gland is the main reason for hypothyroidism. It can occur due to anything. It can occur due to any disease. But the main pathology is that the thyroid gland is not acting up to its potential. So what will happen if the thyroid gland is not acting properly? There will be less secretion of T3 and T4. There will be less secretion of T3 and T4. So there will be less secretion of T3 and T4. So peripheral tissues will be having less of T3 and T4. So the metabolism will be affected. And if you go back to the previous slide, just go back. I've given here this red markings you can see. If there is a lack of T3 and T4 in the peripheral tissues, there will be a negative feedback that goes to the anterior pituitary. Another negative feedback goes to the hypothalamus. So this negative feedback, they stimulate the anterior pituitary and it starts secreting more of thyroid stimulating hormone. Another negative feedback goes to the hypothalamus and it in turn releases TRH, the thyroid tropin releasing hormone. It again stimulates the anterior pituitary and it releases more of TSH. So what happens in these cases? Finally, what we find in the serum when we go for a serological test, we find that there is an abundance of TSH. The TSH level goes up because of the negative feedback. And for a small information, that this T3 and T4 of this T3 and T4, T4 is more predominant and T3 is secreted in very small amount. And of this nowadays you will find whenever we advise for a patient, we normally, as for I do it personally, I advise the patients to go for TSH and FT4. That means free T4. Why? Because free T4 is more metabolically active. Total T3, T4 is not so active, but free T4 is more active. So that is more significant. Assessment of free T4 along with TSH is more, logical. Now, what is the scope of homeopathy? What is our scope? Very simple. We have to stimulate the underactive thyroid gland to perform on its own. If it can be stimulated by our medicines to perform to its own potential, then the problem will be solved. It's very simple. So in doing so, we have to devise some approaches. How will we approach these cases? Now, scope we can work better in cases which are designated as subclinical hypothyroidism. What is subclinical hypothyroidism? Subclinical hypothyroidism is a condition where the TSH levels remains less than 10. It crosses the normal level, that is almost 5 or 5.5 in some, differs from laboratory to laboratory, and it does not go up 10, go up beyond 10. So it remains within that, and T3, T4 or FT4 remains normal. Just remember this thing. FT4 or T3, T4 will be normal, TSH will be more but less than 10, and interestingly, there will be no or very minimal overt features of hypothyroidism in the patient. The patient will not be having a lot of problems, a lot of complications. So these cases are known as subclinical hypothyroidism. I once asked one doctor, allopathic doctor, that what do you do in subclinical hypothyroidism? He told me that we are divided. Our opinion is divided. Some suggest that we should act on subclinical hypothyroidism. Some suggest no, let it be like that. It can get corrected. And in many reference books, you'll find that in many cases of subclinical hypothyroidism, it has been seen that the TSH levels gets reversed and goes back to normal. It happens. But I think that these are very virgin cases that we should act upon. And if we can correct the subclinical hypothyroidism with our own medicines, it can happen that the patient will never suffer from any thyroid problem in the future. So it's a great scope for us. Another scope that I found is in instituting constitutional treatment in children who have been born of a hypothyroid mother, of a hypothyroid father. So, if there is a clinical history of hypothyroidism in the family, especially in the parents, but the child is absolutely normal, we can keep in the back of our mind that we have to start a constitutional treatment so that this child does not suffer from hypothyroidism in the future. We can do it. Another scope is in pregnancy. You know, that just keep in mind that in pregnancy, when a lady becomes pregnant, this TSH level becomes slightly high. It doesn't remain within the normal, it goes slightly high. So these are called mild cases of hypothyroidism. But if that lady is having some complications, some problems, we can definitely institute homeopathic treatment. And that will not harm her baby, that will not harm her pregnancy process. So that pregnancy process can be very smooth. That is also a very big scope that we are having while we are treating hypothyroidism cases. Another is nowadays, if a patient comes to you, after thyroid resection, say for example, the patient had cancer of the thyroid, and he underwent a thyroid resection or thyroid surgery, or following this thyroid resection or surgery, he had radiation therapy also. In these cases also, we find that the TSH levels goes high because the thyroid becomes underactive. After this thyroidectomy or radiation therapy, the thyroid gland becomes underactive, as a result of which TSH levels becomes less. In these cases also, we can stimulate with our medicines and raise up the TSH levels. And it works better. Our medicines work better in early cases. We have to detect them early. We have to denote them early, and we have to tell the patients that this is a time that you must have some treatment. And one point you can see that works better in unpolluted cases. What do you mean by unpolluted cases? The cases which are very virgin, which have not been polluted with allopathic medicines, especially I'm talking of levothyroxine, eltroxin or Thyronorm or Thyrox. The basic drug is levothyroxine. So the cases which are not, not the cases which are not dependent, or which have not started this levothyroxine therapy, that's also a very good scope for us. In those cases, very recently, I remember I got a case where the presentation was a digestive problem. The lady came to me, around 35 years old lady. She came to me with a digestive problem. She told me that, I have been taking liver drugs, I've been taking this digestive drugs, but my digestion is not working properly. So mark my words, these are the points where you have to keep in mind that there might be some blockage. There might be some blockage. So that lady was taking allopathic medicines, that lady took some homeopathic medicines, but still her digestion problem was not getting corrected. What was the problem? She was always continuously burping. She was continuously burping. That was the main problem. And when I got that case, the first advice that I gave her, go for a blood test. I did a LFT, I did a pancreatic test. At the same time, I advised for a thyroid test. And to your surprise, you will be surprised to know that LFT was normal, pancreatic lipase amylase was normal, but TSH went up high. It was around 10 plus. So in these sort of cases, you can start your homeopathic treatment, and the patient is much better now. I'm just waiting for the TSH results. I will ask her to go for another test. And I'm very confident that the TSH levels will be coming down because the physical symptoms are quite better right now. So these cases you can target very easily. Now, common presentation of hypothyroidism cases. How will you know that this case can be? I just told you one case that it came to my mind that when the conventional drugs are not acting, so there might be some blockage, and hypothyroid can be one of the blockage. And I actually, I have been repeatedly quoting Dr. Roberts, because this is one person who has written about hypothyroidism, uh, about endocrine disease in his book. And if you go through that article from his book, you can find these quotations. I'm not wasting time on this. Tiredness, unexplained fatigue. You will find that a patient who was active nowadays has become very fatigued, very tired, always lying, always sleeping, catching cold very easily. Constipation, unexplained constipation, unresolved constipation, dry skin. The doctor, my skin is getting dry, I don't know why. The hairs are getting coarse. These are all presenting features of hypothyroidism. Excessive loss of hair. Women can come to you whenever I'm combing, a lot of hairs are falling out. This can be a presenting feature. Weight gain is a very common presenting feature with which patients come to us. Puffy face, the face is very swollen, especially in the morning time. Hoarseness of voice is another. A singer comes to you, tells you, Doctor, I'm suffering from hoarseness of voice for the last 6 months. I've been taking a lot of drugs, causticum, carbovage, selenium. It's not acting. When you go for a thyroid test, you find that the TSH levels have gone up. Disturbance in menstrual cycle, very common presenting symptom for ladies to us. Infertility, that is, I've seen in many cases with, infertility, primary infertility, secondary infertility, where this hypothyroidism is a blockage in that process. Muscle weakness, aching, tenderness, and stiffness. That's also presentation. Unexplained leg pain, unexplained pain in the calf muscle. Doctor, I'm walking and I'm having pain in the legs. I've been taking I've been taking painkillers, is acting for a short while. So these are all presentations of hypothyroid. Slowness in movement and speech, mental impairment, especially in young children, memory and concentration problems. And one thing is being gradually noted nowadays, that the mothers who were hypothyroid during pregnancy, they are giving birth to ADHD children. Children who are being born of hypothyroid mothers are suffering from attention deficit hyperactive disorder. So these are all presenting symptoms of. So this child of ADHD is a potential sufferer of hypothyroidism in the future. And bradycardia, that is slowness of pulse. When the pulse is constantly below 60, that person is not an athlete, that person is not a hard laborer, still his pulse remains very less. He's not suffering from any liver problem, jaundice, still he's having bradycardia. So this can be all presenting features of hypothyroidism. Risk factors of hypothyroidism, a lot of risk factors, of which I will just only tell about this cardiovascular disease. If hypothyroidism remains untreated, then it can lead to cardiovascular problems, because there can be a concomitant rise of cholesterol. That cholesterol can become a threatening factor, resulting in CV diseases. Goiter, preeclampsia, I'm not going into the details. This thing I will, I will emphasize on this thing, this risk of infertility. If hypothyroidism is not treated properly, then the patient might suffer from infertility. That's a very common presenting thing for us. I've got many cases of infertility in my clinic. Now, management. This is the main thing that needs to be discussed. I've got another, I think, 15 minutes, 10 or 15 minutes. So I'll be finishing fast. Now, in managing, first you have to diagnose the case. So you have to advise the patient that please go for a test. And when you go for a serological test, you will find that the TSH levels are high, beyond normal. It can be 5.5, it can be 4.78, it can be 5. Beyond 5.5 is definitely raised levels of TSH. And the T3, T4 can be normal, or the T3, T4 can be reduced. That's very interesting. In hypothyroidism, when the TSH level goes up, the T3, T4 level goes down. It's a seesaw effect. In hypothyroid, it's just the reverse. In hypothyroid, T3, T4 levels goes down with a concomitant increase in the TSH levels. Now, in allopathic mode of treatment, they are only having one gold standard. What is that? That is, replace the hypofunctioning of the thyroid the underactive thyroid gland, stimulate the underactive thyroid gland with a daily replacement dose of levothyroxine. That is the only gold standard that they are having. But it may sound very logical that yes, the thyroid hormone is not active properly, the TSH levels are less. So if we can replace it with levothyroxine, it will work normally. So logically, it's very, very sound. But what happens? What happens is that with this levothyroxine, regular dose of levothyroxine, many things happen with in the patient psychology. First thing, the patients become very, depressed with the regular dose of hypothyroidism. They feel, some sort of boredom that I have to take the medicine for the whole life. That's simply not acceptable for me. That is one factor. Another factor that I've seen personally in my clinical practice is that in spite of regular doses of levothyroxine, maybe the TSH levels become normal, but all the problems are not getting solved. A patient with hypothyroidism may suffer from 3, 4, 5, 6 symptoms, but one out of symptoms will be, corrected. But there can be excessive hair loss, there can be excessive slowness, there can be excessive depression. So these sort of features will not be corrected with daily dose of levothyroxine. So that is also one of the reasons that patients are they're willing to wean off the daily doses of levothyroxine, and they're coming to us that do something for us so that we can become normal like before. So we have got a lot of scope. And according to my own experience that I'll be submitting tonight over here, that the underactive thyroid gland, hypothyroidism in homeopathy can be treated by different approaches. We all know we have been taught that the classical homeopathy, the constitutional therapy is the best therapy. Definitely, there is no question about it. There's no doubt about it. But I have found in my practice that another couple of approaches can be adopted while treating hypothyroid cases where constitutional therapy fails. So the first approach that I will be discussing today is a classical approach that we have been taught, that we are practicing, we are teaching to our students. So the first approaching in managing cases of hypothyroidism is by instituting constitutional treatment. And definitely this should be the gold standard in homeopathy. The first approach, that is constitutional treatment of hypothyroid cases. The cases can come to us like, the case that I discussed in the beginning, the doctor, I'm suffering from hypothyroid, give me some medicines. It can approach to us. It can approach to us as a multi-morbid case. Comes to us with a lot of complaints, and with our clinical expertise, with the clinical acumen, we can diagnose that this patient might be suffering from hypothyroidism, and in that process, we have to deal. Whatever be the approach, the challenge is that you have to cure the patient, and at the same time, the additional challenge that we are facing nowadays, that our seniors did not face around 30 or 40 years back, that we have to fight with the paper also. What is that paper? When the patient comes to us, the patient tells us, Doctor, I am very fine. But you see, my thyroid levels have not come down. I was having 10, it's 8. So still I'm having thyroid problem. So this is the real challenge that we are having. Okay, we have to cure the patient, we have to relieve the patient. At the same time, the paper should also reflect that the levels have come down. And in this challenge, the first approach is the best approach, is a gold standard. I'm not going into the details. Hahnemann has already given the tips. Aphorism 5, aphorism 210, and Dr. Shani sir is there. He's the best person to explain these things. We have to go for the physical characteristic. We have to go for the patient's disposition, the mental symptoms, and then we have to form the totality. Dr. Roberts is also having his own opinion that the subjective manifestations has to be taken with a view, keeping in view the Hahnemann's instructions in case taking. So apart from the presenting features, that is the objective symptom. What is the objective symptom? The paper which states that the TSH levels are high, or one or two features like the patient has become obese or there is excessive hair loss. This can be the presenting features. Apart from these objective symptoms, and these objective symptoms are the point of interest of the doctors. For us, these objective features are just the beginning point. we have to go beyond that objective point, and we have to note the other symptoms also, like the emotional reactions of the patient, the individual subjective manifestations according to Hahnemann's instructions given in organ. And by that way, we can build up a totality. And in that process, we can take help of our repertories. We are having very good repertories. We can open repertories. We can ask questions. We can solve the cases from the repertories also, taking the constitutional symptoms of the sick individual. So the main thing is that in the first approach, our attention should not be limited to the thyroid gland only, but to the patient's individual characteristic. I'll give one or two case illustrations very quickly. A female, 60 years old, she was suffering from pain in various parts of the body. In addition, she was having a pain in the epigastric region, and she was very thin and emaciated. So the main problems were orthopedic pains, diagnosis, cervical spondylitis, lumbar spondylitis, and right frozen shoulder. Pain in the neck, extending to the occipital region and the shoulders, going up, going down. Pain in the neck while turning to sides, and she was often having some vertigo. This is very common in cervical spondylitis. Pain in the lumbar region, lumbar spondylitis. Aggravation, initial movement, rising from sitting. This modality is very important. The back pain is crampy in nature, and pain in the legs, which is actually known as radiculopathy in neurological sciences, which is aggravated by walking and taking emulation by taking rest or sitting. Gastric symptoms, the patient was having pain in the epigastric region, which was aggravated in empty stomach, and after waking in the morning when she was absolutely empty, cannot tolerate hunger. This is an individualistic character of the patient. Nausea, non-specific nausea, and she used to suffer from sour taste of the mouth. Prefers cold water to drink, and she had an intolerance to fish odor. These are all individualistic symptoms. Emotional symptoms, the face of the patient was expressive of anxiety, and she had an apprehension that she might be suffering from some incurable disease. So this fear of disease was very, very prominent in this case. Diagnosis, CS, LS, gastritis, anxiety, neurosis. She was asked for a thyroid test, and she came to me this test was done in May, 4th May. You can see it was 10.02. But this test done, this reportation was done, calculator was given. 9 symptoms were taken, 9 rubrics were taken, and calculator force was given to the lady. Calculator was 200 because the mental symptoms were very prominent. Now, the next visit, when the patient comes with the thyroid test 10.02, patient states that the pains are much less. She is relatively better in terms of gastric problems, and hypothyroidism was another diagnosis that was detected in addition to CSLS and everything. So calculator force was continued because I did not consider the hypothyroid. I was going for the constitutional treatment. Now she came in June 2022. Suddenly the pains were more. And June, it's a rainy season over here. So I was thinking of Ras talks, but she gave me another symptom, that is, she had an unsteady gait. She was talking that I was having I cannot walk properly, and there's a tendency to fall forward. So with this symptom, I gave her Manganum aceticum. After that, she came in August 2022. She was much better. Pains were better. Her walking was better. Everything was better, but she was anxious. Now, again, I went back to calculator force 0/3. Then there were some follow-ups in 2022, and she was better clinically. There were one or two minor instances of exacerbations. Calculator force was continued in LM potencies with sometimes some intercurrent remedies were required. And in 2023, she was asked for a TSH test to be done. And after much insistence, she went for a TSH test. And you can see in April 2023, it was 5.36. You can see over here, 8th April 2023, 5.36. She was almost out of medicines right now. And now it's normal. 5.5 was the upper limit. Now it's 5.36. Patient is clinically stable. No medicine was continued. and she was advised to check TSH periodically. And in December 2023, just last December, she went for another TSH test, and you see that the TSH levels are 4.96. So without medicine, if constitutional medicines can correct the diathesis, the TSH levels will remain normal. So that is a gold standard. It's a multimorbid case, and hypothyroidism was a part of that. Another case, I will move fast. Second case, 34 years, secondary infertility. I told you that these are very common presenting symptoms, secondary infertility. The lady was married for 7 years. She had a cold catching tendency. She was having chronic sinusitis and chronic pharyngitis. She was fair and obese. She conceived post marriage, but there was spontaneous abortion. This is also another presenting feature of hypothyroidism. Folliculometry revealed healthy eggs, and the patient was minor beta thalassemia positive. Details you can go through. I'm not going into the details. The constitutional symptoms were a lot of sweat, especially in the palms and soles. The patient was chilly, and patient was especially desirous of eggs. And she suffered from sudden palpitation also. Sometimes she suffered from sourness of mouth with indigestion, and she was taking eltroxin in a very low dose, but she could not conceive. She was given Calcarea Cup 200. Calcarea group of drugs are very good for hypothyroid cases. February 2018, the TSH was 8.33, cholesterol was normal, TGL was normal. The torch profile was done, and it was found that the rubella antibodies were moved. So we cannot tell exactly whether the thyroid was the responsible factor or the rubella antibodies were the responsible factor for the secondary infertility. Anyway, the case was of secondary infertility right now. Patient was better, no cold, acidity was better, Calcarea was continued. But in spite of this constitutional treatment, she could not conceive. So there was a consideration of change of plan of treatment, and she was given thyroidinum. She was given thyroidinum, started from April 2018, May 2018, TSH 5.3. And in May 2018, she went for an ultrasonography, and it was found that he already had a baby. She had a intrauterine viable embryo. Again, she went for a repeat sonography in July 2018, and the same thing was. So she became positive. She became pregnant. So these are actually constitutional methods of treating hypothyroidism, classical methods. You need to change the medicines according to the situation. And over here, hypothyroidism was acting as a block in this case. So this is one approach. The second approach that I have found in my practice is best advised in cases where constitutional approach fails to give the desirable results. It is also our experience that constitutional approach sometimes fails. In these cases, I have seen that in managing cases of hypothyroidism, we can constitute constitutional treatment along with thyroidinum 3x. We are having a very good medicine, thyroidinum 3x in tablet form, which was actually first devised or prepared by Dr. Clark, most probably, from the sheep's thyroid gland. So I've seen in many cases this constitutional treatment along with the supplementary medicine of thyroidinum 3x also helps. So this can be a second approach that we can advise. And the second approach can also be, taken into account where the cases are polluted cases. That means the cases are dependent on synthetic thyroid hormones, levothyroxine. In these cases also, we can institute constitutional treatment along with thyroidinum and gradual reduction or absolute stoppage of thyroid medicines. We can do. This can be the ideal cases of second approach. So we can gradually reduce the levothyroxine along with constitutional medicine. And in some cases, I have seen that constitutional remedy plus introduction of thyroidinum 3x with gradual withdrawal of levothyroxine yields very good results. These cases can be, and the patients are very happy that yes, I've got rid of the allopathic drugs, and we can do it and then when the levothyroxine is withdrawn and the levels are normal, we can gradually withdraw the thyroidinum 3x, only keeping the constitutional remedy. So this can be another approach in treating cases. A small case I'll just present before you It was another case of primary infertility. That lady came from Bhubaneswar to me, far away from my place. She had irregularities in menstrual cycle, 30 years, irregularities in menstrual cycle, like delayed cycle, clots, pain in the abdomen, and she had a gradual weight gain. She was getting obese. And mentally, I found that the lady was very soft, yielding in nature, emotional part. On investigation, it was found in the sonography that she was suffering from polycystic ovaries, PCOD, and the thyroid hormones were more. I don't have the report, so I cannot present it before you, but I have the case with me. Diagnosis was PCOS, polycystic ovarian syndrome, and hypothyroidism. Constitutional medicine that was given was Pulsatilla based on the emotional symptoms. Pulsatilla was given. After Pulsatilla was given, the menstrual cycle became regular, but TSH remained elevated. The TSH did not come down. There were mild features of PCOD, polycystic ovaries, but the main concerning thing in this patient now was that she could not conceive. Okay, I changed the plan of treatment as because she was suffering from polycystic ovaries, she was not being able to conceive, and the constitutional remedy Pulsatilla has relieved up to a certain point. So I started Uforinum along with thyroidinum 3x in tablet form. And after a certain time, she conceived and gave birth to a baby girl. Another girl is almost 8 years old. So this can be another approach where the constitutional remedies can be supplemented with our own thyroidinum 3x with a gradual reduction of levothyroxine. This method also can be instituted where the constitutional approach fails. The third approach, I will not take much time. The third approach will be in managing cases of hypothyroidism where only thyroidinum 3x has been given. Now, this third approach I never endorse. That is never a classical method. But interestingly, I've got one or two cases in my life. I'll just tell you one case over here, very interesting. This third approach can be adopted where no constitutional, peculiar, and uncommon symptoms can be obtained. Where no peculiar symptoms are obtained, we are actually, rudderless ship. We do not know the direction in which we go. We don't have any uncommon peculiar symptom. The patient cannot tell. It can happen. So in these cases, we can approach approach these cases with a third approach. I remember one case. I'll just tell you this case, and I'll just log out of the of our today's discussion. One young man, he was early my patient. He was residing outside my city. One day he called me in 2022. He called me, the doctor, I'm suffering from thyroid problem. I told, what is the problem? He told me my TSH levels are high. He didn't know what is hypothyroidism. He told me my TSH levels are high. So please, doctor, I cannot go to your clinic right now. Give me some medicines. I told him that this is not the right way to treat. You show some other local doctors, or you come down to my clinic someday, take a leave from your office, come down, where I will take your whole case. But he kept on insisting, doctor, I don't have time, I don't have leave, I cannot go there, and you have to treat me. And he was hell bent on getting a medicine. And out of just frustration, you can tell. This was a report in May 2022. The thyroid levels were 8.66. He only went for TSH. He did not do T3 or T4. So I cannot tell whether it's a case of thyroid hypothyroidism or a subclinical hypothyroidism. But more or less, it was almost a case of subclinical hypothyroidism. The TSH levels were more, 8.66 in May 2022. And upon his insistence, I prescribed, okay, you take thyroidinum 3x. It's available in the medicine counter. You go and take the tablets. No other medicine was prescribed because I didn't have the case. And he went on sincerely taking thyroidinum 3x. I forgot about the case. These are the reports he submitted later on to me. June 2022, it was 8.79, slight reduction. He continued with thyroidinum 3x in September 20, and he was doing these tests on his own without my knowledge. In September 2022, it came down to 6.04. Again, he continued with thyroidinum 3x. In October 2022, it was 6.41. He continued with thyroidinum 3x. And I told you that I was unaware of the patient. I forgot about the patient. In 2022, he started thyroidinum 3x and he was continuing. And in this January 2024, he came with his sister. And his sister was suffering from hypothyroidism. She had a lot of hair loss. She was suffering from hypothyroidism, and she was brought by this young man that go to him. And then he revealed to me, doctor, you remember you told me to take thyroid 3x, and I took it sincerely. And in January 2023, almost a year back, the thyroid levels became normal. So this can also happen with our drugs. That is the beauty of our homeopathic drugs. When you don't have a constitutional, medicine, when you don't have the patient in hand, this can be also an approach. Though I repeatedly tell you that this approach should not be endorsed, but I found that it also helps. So the thyroid levels were 3.4. Unfortunately, he could not submit that paper to me. And in support of this third approach, you can go for this study conducted by Wilma Schwabe, where they have shown that thyroidinum 3x can be compared to thyroxine, allopathic thyroxine. A preliminary scientific study was done by them, and they showed that it's quite capable enough to help in hypothyroidism cases. This is a study worth reading. You can get this article from Wilma Schwabe, or you can get it from me. You can dial me, direct message me. This is the last slide. From the conclusion, you can find out it's written over here that the data clearly show that thyroidinum 3x is comparable to the thyroxine supplement given in cases of hypothyroidism. So it's a very good supplement. Sometimes it can help where we are helpless. The patients are not coming to us in our clinic, so we can work with thyroidinum 3x also. But at the conclusion, I will tell that the first approach, the constitutional approach, is the best approach, and it should be always advised for the patient. It should be always followed. The second approach is an approach when the first approach fails, and the third approach is a negligible approach, should not be adopted. But in my own experience, I've seen that it works also. That is the beauty of homeopathic drugs, and it has these results accumulated over the years of my clinical practice has given me experience, has given me enough confidence to treat hypothyroid cases. Nowadays, I'm treating diabetes mellitus cases also, some of the cases, and they're giving good results. It's not that these endocrinological problems cannot be solved with homeopathic medicines. It's not that. This is the thing that I want to emphasize over here, that we also have got a great scope in treating these endocrinological disorders. So this was my lecture today. Thank you very much. Over to Dr. Danish.
It's really, means it's really a very good session, sir. Really an excellent session. You covered almost every part of this thyroid disorder and how
काम कर लो. It
homeopathic,
has stopped erupting. Past tense लिख दो.
how homeopathic doctor can manage the thyroid cases in different conditions and different situations. How what are the methods homeopathic doctor can choose in different situations also. Direct, as you rightly pointed out, the constitutional treatment is the best. And of course, in between constitutional treatment as well as the pathological prescriptions are also getting good in all the cases you have shown. So this is what the beauty of homeopathy. Let us go to the discussion. Dr. Hariharan sir is already there. Only a few minutes are remaining. All of you can talk in short way. So to Hariharan sir. Please unmute, sir.
Sir, can you hear me, doctor?
Yes.
Okay, sir. Sir, can you explain how will you manage the anti-TPO cases first?
Anti-TPO cases, according to me, will be best solved by constitutional treatment. It will. I have seen that in anti-TPO cases, constitutional treatment is the best method, and we have to change the plan because some symptoms change while we are treating anti-TPO cases. They are very difficult cases. especially these autoimmune diseases. But in these cases, we have to change the plan of treatment. Especially, I found that this chemical group of drugs, calcarea, then baryta group, barium group, natrum group, they're helping us very much.
Okay, sir. Thank you. Next, see, how will you manage the nodules? Thyroid nodules.
Thyroid nodules. Okay. Actually, this thyroid nodules, okay. Thyroid nodules may not be having hypothyroid features. TSH levels can be normal. If you go for, I go for some pathological prescriptions in these cases, thyroid nodules. And I have found calcarea iode and baryta iode. These two drugs has helped me a lot. Calcarea iode and this baryta iode. And in some cases I have seen, in fact, I have read some cases also, calcarea fluor helps also.
Okay. Okay, thank you, sir. I will try. I will try this. Okay.
Yes, sure. Please give the feedback. We need to
Okay.
have a protocol. We need to have a protocol.
Calcarea iode, baryta iode, sir.
Yeah, calcarea iode, baryta iode, and calcarea fluid also you can.
Calcarea
You can.
fluid. I can try. I can try.
Yes,
Dr. Dr. Aljendra, you can unmute and speak. Yes, please unmute. Please unmute and speak. If you want to talk, please unmute yourself. Please unmute. Oh, you are not able to do. Dr. Marian Salcedo, want to speak? Please unmute.
Hello to everyone. Good morning, good evening, good afternoon. Thank you very much, Dr. Yeah, sorry for the video. I believe it's not going well. Yeah, it was an amazing session. I believe that we have to improve a lot. There's a lot of remedies and new remedies for me. So I will be starting there. And thank you, Dr. Partha. It was really, really amazing session. We have a lot of cases of hypothyroidism in South America. So thanks to your conference, I feel that if I study, I will be able to help all of these patients. So thank you very much. And thanks to all IFPH team that always are doing a great job. Thank you, Dr. Dinesh.
Thank you. Now I invite Dr. Shaji Kuti, the Vice President, to say a few words.
Yeah, it was nice listening to you, Dr. Partha. It was a wonderful presentation. And regarding thyroid hypothyroidism, if we allow our patients to go and take the allopathic medicine, that is a supplementation, they need to take it for the whole life. By undergoing our treatment, we can cure it, provided along with the medication, if you identify and rectify the causes that produce the problem, including the life situations, the mental emotional problems like that can give a complete cure, and the recurrence can be prevented also. So that is advantage. So a lot of scope for the suffering humanity from homeopathy. So it is highly necessary we should spread it, should promote it, and we should make the world aware about the advantages of homeopathy, so that this wonderful system of medicine will remain beneficial and useful to humanity at large for this generation and generations to come. So it is the necessity that we don't forget, and we should collectively act, respond, and work for in our lifetime, so that the future will be benefited. Thank you very much.
Right.
Yes, the contact numbers and everything are there in the poster we have presented. Those who want to communicate, you can directly go to the poster itself, and where everything is written. If you want to say anything, we can go ahead. Otherwise, we are about to say the vote of thanks to the session. I invite Dr. Neha Thakur to say the vote of thanks to Partha Chakraborty, sir.
Yeah, it was a very nice session, sir. And Dr. Partha Chakraborty provided some very invaluable gems about treating hypothyroidism cases with homeopathy. And many homeopathic doctors are engaged in this work of treating hypothyroidism and hyperthyroidism cases with homeopathy, because once the allopathic medicine is started, it keeps on increasing and increasing and goes on for the lifetime. So we homeopaths can do a lot of work in this field, as also advised by Dr. Parthi. It was a wonderful session from him, and we hope in future also we'll have much more sessions from him. Thank you, Dr. Partha Chakraborty. Thank you so much.
Tomorrow we will have a session from Dr. U.K. Verma, MD, and he is the Vice Principal of GD Homeopathic Medical College and Hospital, Patna. And the subject is local maladies with reference to one-sided diseases, and that will be discussed tomorrow. And with that, Partha sir, you want to say anything more?
No, I've spoken a lot. You can also share some experience if you have the
Yes.
time. Oh, I think
Yes,
we
yes,
are
yes.
over.
With that, we come to the end of the day, 1272, and with tomorrow we will have the same meeting at the same time. We hope all of you will be there with us. See you all tomorrow. Thank you all. Good night. And it is over to Dr. Mariamma John to begin the Malayalam session.